Most back disorders are the result of stressful living and work habits, our faulty body mechanics, poor posture, loss of flexibility, and the general decline of our physical health. Exercise is medicine, as is a healthy, natural, high-fiber diet. The more we weigh, the faster our joints wear down. From neck to sacrum, we have 23 intervertebral discs and 48 facet joints will last longer if we maintain a healthy weight and say no to cigarettes. If you stop smoking, your spine will thank you. Smoking poisons and reduces the blood flow and nutrients traveling to healing tissues. Back pain affects 8 out of 10 Americans in their lifetime. It doesn't just stop you from being able to go to work, but being able to relax and enjoy life is just as difficult. Without exercise, your spine is stuck in a state of loud chaos. Studies show that yoga is a reasonable intervention for multiple spine conditions. A meta-analysis performed by Kramer in 2013 evaluated the performance of yoga versus control conditions on outcome measures such as pain, disability, and quality of life. In 10 randomized controlled trials, with a total of 967 chronic low back patients, there was strong evidence for long-term effect on pain, moderate effect on long-term back-specific disability, and no evidence for the effects of health-related quality of life. There were also no injuries or adverse events associated with the practice of yoga. In the short term, there were improvements in pain, improvements in back-specific disability, and overall global improvement. The conclusion? When it comes to patient-centered outcomes, there is strong evidence for short-term benefit and moderate evidence for long-term effectiveness. Of course, more randomized controlled trials are needed, and how yoga compares to other back-specific exercise has not yet been determined. For this program, you will need a mat or a mattress, at least 2 pillows, and you'll need the equivalent of a yoga belt. This is an item such as a towel, or a pillowcase, or a 6-inch ace wrap, or check your closet for an old pair of spandex. The mattress is a perfect alternative for those who have difficulty getting up from the floor, or if you're in too much pain to get out of bed, but you do want to start the recovery process. As a beginner, only hold each pose for about 10 to 15 seconds. As you progress each week, add another 5 to 10 seconds, up until you reach the point of being able to hold each position long enough to maintain your improved condition. Make sure your pillows are able to support your weight without collapsing. Folded blankets work too. Although I am a healthcare provider, I'm not the one who knows your current state of health. I recommend discussing this with your provider before proceeding. Severe pain is an indication to stop. If you're going to be using your mattress, make sure you have enough room around you to prevent falls. First exercise, the modified boat pose. Ujja Navasana. 2. Your legs are together and your feet are planted. 4. Lower your chin and lift your head and upper body while supporting your head and neck by creating a hammock using a pillowcase or an old pair of pants or whatever you can find. Start with your head on a supportive pillow and a pillow below your knees. Move up the pillow so the top edge is against your sacrum. This will give your lower back more support. Bring up one leg toward your body at a time. Roll your pelvis forward slightly and feel as though your abdomen is creating the shape of a bowl. Your back should feel flush against the floor or mattress. Take your towel or pillowcase and gently place it behind your neck. If you're going to use an ace wrap, make sure it's wide enough to support both your head and neck. Breathe in through your nose, and as you breathe out, slow and smoothly, you will lift your head and neck up as one and hold the position. 1, 2. Exercise number 2. Low bridge pose. Akula Bandha Sarvangasana. Your head and neck will be supported by a pillow. 5. Feet are flat to the floor. You're going to tilt the bottom of your pelvis forward. Slightly lift your pelvis off the floor and hold, bending one knee at a time. Bring your legs toward you and your knees together. Bring up your pillow for more support. Tilt the bottom of your pelvis upward. You should feel like you're sucking your abdomen in. Make sure your back is flat against the mat or mattress. Push with your heels, tilt your pelvis up, and lift only a small amount. A millimeter is fine. But make sure the bottom of your pelvis is tilted forward and lifted, and hold that right there. We're going to add activity in our arms at the same time. Grab your yoga belt or yoga belt substitute. Fold it up so it's about 10 inches. One hand grabs each end. Bend your elbows and keep your arms pushed down against the mattress or the mat. You will squeeze your shoulder blades together and really lift up your chest. So tilt your pelvis forward, lift just a tiny bit, elbows are close to your body, and your hands are pulling away from each other in opposition while your elbows stay against your body. Push your elbows down toward the floor. Breathe in through your nose. 2, 3, 4, 5. Hold and breathe out. 2, 3. Exercise number 3, the modified locust. Uhya shal abhasana. Begin on your stomach. A pillow is placed at your forehead so you are able to breathe. Another pillow is placed below your abdomen and pelvis, allowing your pelvis to tilt slightly forward. Face your palms to the ceiling and reach your fingertips away from the top of your head. Squeeze your shoulder blades together. Stretch through your heels, pulling your heels away from the center of your body. You will then lift your head slightly above the pillow, stretching through the top of your head. This is a small lift. Think about length, do not think about height. Pull your shoulders down away from your ears. Rather than reaching through your toe, reach through your heel. Pillow supports the upper half of your face. Begin reaching through your heels. You're going to add an arm where you're going to just extend behind you, but make sure your ear is in line with your shoulder, in line with your hip. As you reach with your fingertips, your shoulder should feel like it's reaching away from your add the other arm. You're going to breathe in, lifting your head and neck in one unit, at the same time squeezing your shoulder blades together and lifting your chest. This is only a small lift above your pelvis. Breathing out. Breathe in through your nose. Exercise number 4, modified half locust pose. And breathe out. Shalabhasana. Pillows are again at the forehead and under the pelvis. You will lift your leg up slightly to the level of your glutes or slightly higher, reaching away from the center of your body through your heel. Flex your ankle forward. Dorsiflexion. Again, you will be reaching through the top of your head. Really stretch. For a greater stretch, we'll add an arm. The arm opposite to the elevated leg. Head is supported on the pillow, reaching through fingertips, reaching through the crown of the head, and reaching through the heel. If lying on your stomach is bothersome, a similar stretch can be performed while laying on your side. If you're on your side, you have to move your pillow up so it's under your waist. The top of your hip bones should be directly in line with each other, not tipped forward or back. One is not higher than the other. And support your neck. You will again reach through your heel and you will flex the ankle. There is a space between both of your legs. The upper arm can be placed in front of you for balance and support. More advanced, lift the arm up over the ear and stretch through the fingertips in opposition. Also feel as though you're reaching through the top of your head. Your heel and your head are stretching away from each other. Balance takes time. Add the arm when you are ready. Begin reaching through the heel and lift. Reaching the arm, stretching through the fingertips. Breathe in through your nose. Reaching through the top of your head. Hold for more, and breathe out. Stretch the other arm in opposition and reach through those fingertips as well behind you, similarly to the last extension exercise. 5. Hold 1 and breathe out. 2. Take a breath. Get ready to switch to the other side. Uhya Ardha Shalabhasana. Flex the other ankle and reach to the heel, pulling away from the center of your body. Reach the opposite arm so it's close to your ear and stretch through your fingertips in opposition to your heel. If you're ready, try adding the other arm. Your arms are pulled away from each other in opposition, and you're still reaching through the top of your head, lengthening your neck as well. Hold 1 and breathe out. 2, 5. Breathe in through your nose. 2, 3, 4. Hold. The modified reclining big toe pose. Hamstring flexibility is important for all types of back pain. The hamstrings originate from the bottom of the pelvis and insert to the lower leg, just below the knee. If the hamstrings are too tight, it will pull at the pelvis, disrupting its neutral tilt, and creating a strong force that your back muscles have to counteract when standing. These dynamic forces can lead to an excessive curvature of the lower back, referred to as lordosis. The red dots in this figure show the muscles that are tight in dynamic lordosis. This stretch is performed on the floor, providing support for the back. The leg to be stretched will be elevated toward the ceiling. We will begin by bringing the thigh to the chest. The hip will be flexed to 90 degrees. This means if someone were looking at us from the side, the thigh elevated toward the ceiling, along with our belly and our chest, seems to make the letter L. Flexibility builds over time, and after a while, you'll be able to straighten your knee more and more, and you'll be able to extend the opposite leg more and more as well. To help with technique, a wall can be used or your yoga strap alternative. Start by bringing the knee to your chest and placing your hands over your shin bone. We're going to hold this for a little bit. I'm going to be using my ace wrap. Only flex the hip to a point to where you feel some challenge, but not pain. Throughout this exercise, you'll see me slide back and forth with my opposite leg to show you the variation. For effective stretching, you need two things. First, you warm up your muscles. This will reduce any micro-injury. Plastic can bend more when it's warm. If it's not warmed up, it snaps. Our muscles are similar. The second most important thing is to breathe. By holding your breath, you're anticipating pain, and your muscles will tighten in anticipation to protect you. Place your strap across the bottom of your foot. One hand will be at the end of each side of the strap. Slowly extend your knee. You should feel challenge, you should feel discomfort, but you should not be in sheer agony, and remember to breathe. Hold and breathe out. Breathe in through your nose. Breathe in through your nose. Hold and breathe out. And breathe out.
Switch to the other side.
And breathe out. Breathe in through your nose. 5. Hold and breathe out. Breathe in through your nose. 3, 4, 5. Hold and breathe out. 3, 4, 5. Breathe in through your nose. 2, 5. And breathe out. 2, 3, 4, 5. Begin to advance the strap across the bottom of your foot. With control, slowly extend your knee. And breathe out. 2, 3, 4, 5. Breathe in through your nose. 2, 3, 4, 5. And breathe out. Bring your arms out to the side and relax them for the final pose, which is simply corpse pose. Shavasana. Close your eyes and imagine warm, heavy sand being poured in through the top of your head, spreading down your face, your neck, your chest, your back, through to your fingertips and traveling all the way down your legs, out through your toes. You're heavier, you're more comfortable, you're more relaxed, and you're ready to do whatever else you need to do in the day. Now that your back muscles are better trained and stronger, let's focus on keeping them from becoming overworked. Proper posture considers the effects of gravity. Keeping ear over shoulder, over hip, over knee, over ankle will reduce the amount of work that your back and neck muscles need to produce in order to keep us from falling forward. Weight equals mass times gravity. In this example, the more forward your head is, the further your ear is from being directly above your shoulder, your back and neck muscles have to oppose a larger weight. And as a result, your back and neck muscles will tire and start to hurt at a faster rate. When looking at a person or a body part from the side, we refer to what we're seeing as the sagittal view or sagittal plane. When looking at a person or a body part from the front, it is referred to as a coronal view or the frontal plane. The image on your left shows balance and equality. You can see that each line is level, just like putting up a picture frame. Posture begins from the ground up. The position and the weight distribution of our feet can disrupt the alignment of our ankles, thus creating a chain reaction affecting our knees, our hips, our back. Abnormal alignment leads to abnormal force distributions and wear patterns of our cartilage. The cartilage in that area may wear down faster, leading to lost cartilage. The breakdown of cartilage is what we refer to as osteoarthritis, which is a painful and progressive condition as we age and gain weight. Pressures across the intervertebral discs increase while we are seated, making our seated posture especially important. The figure on the right is correct. Just as in standing, the ear is over the shoulder, over the hip. While working on your computer, the monitor should be at eye level. Your feet should be well planted. Planting our feet takes advantage of what we call the normal force, which is represented by the letter N. The normal force is the upward force created by a static surface, such as the floor. When our feet come in contact with it, an opposing upward force is generated. So when we plant our feet, we're supporting our spine as well. Also note well to keep your wrist below your elbow. Your knee should be slightly lower than your hip, and note that the back of the chair supports the lumbar curve. I and your spine thank you for listening.